Hello, beautiful face yogis. Today's video is a level 2 workout in our volume series for restoring the volume of the face back to a youthful distribution by releasing muscle tissue tension that is prohibiting muscle growth, relaxing strained facial retaining ligaments that is causing hollowness and swelling, and then bringing circulation and nutrition to fat cells, allowing for healthy fatty tissue. We certainly can impact the volume of the face. This workout can be done 2 times per week and is recommended in the evening, but can be done at any time. My name is Elise. I am happy you're here. Now let's get glowing together. We'll start by taking a big deep breath in through your nose, sending it all the way to your belly. And then as you exhale, feel the muscles of your face and head fully relaxing. Maintain this feeling of relaxation as we start in eye align with tapping, behind closed eyelids, looking up at your third eye, the area in between your eyebrows, and gently tapping all around your temples, underneath your eyes, on your eyebrows and above your eyebrows, feeling this entire area fully relax and release any tension. And then bring your fingertips to your jaw, giving a little massage, the area right underneath your cheekbones. Take a deep breath in through your nose, and then as you exhale, gently allow your jaw to drop, not forcing it open, but just allowing it to drop with ease. Press your lips forward as much as you can, keeping your O long and narrow, and then bring your fingertips of both hands together, placing your palm ends on your temples, covering the ends of your eyebrows. This is a modified cat eyes, bringing the lips forward as much as you can, bringing the corners of your mouth towards each other. Keep your jaw completely relaxed as you squeeze your eyes in and down against the opposite resistance of your hands, pressing in, up, and back at a 45-degree angle. Feel the activation all the way from your mouth corners, pulling in all the way up past your temple, lifting your entire face. Moving to side face rolls on the left side, starting all the way down at your jawline. Grab a hold of skin and what is able to grab underneath. Squeeze, pinching, stretching, and rolling up the side of your face. Pay attention to any place with changes in volume, any place that feels especially dense or sticky, any place that feels any lack of sensation or numbness. Linger here for a while and try to bring some life and circulation, and then moving all the way up into your hairline as much as possible before switching to the other side. So in an effort to keep these videos at a manageable length, I move fairly quickly, but if you feel a spot that is especially tender or tense, or some of the things we just talked about, then stay there a while, and that's going to be where you want to work. These videos are great for following along, but especially great for using as a tool to discover your own unique face. Deep inhale through your nose, on an exhale, dropping your jaw, letting it fall open, pressing your lips forward, keeping your mouth corners pulled in towards each other. Press your fingertips together before placing on your forehead. This helps to get the right hand position. Pressing in, up, and back, and then squeezing your eyes in and down against the opposite resistance. So feeling that activation all the way up from the mouth corner to the temple. Relax your shoulders back and down. Relax your neck, your forehead, the area in between your eyebrows, and make sure your jaw is completely relaxed. Deep breath in, a long breath out. Go ahead and release. Back to side face rolls. And in this one, we're working with another ligament that provides the tether between the skin, platysma muscle, and tissues around the ear. So this is going to contribute to a smooth transition zone between the face and the neck. So keeping this ligament healthy is going to help keep skin from sagging and staying nice and contoured around the jawline and in between the face and the neck. Switch to the other side, and we'll do side face roll for the last time. So pinching between your index finger and thumb, wiggling or stretching in opposite directions. Make sure to go within and feel what's happening. And then we're moving all the way into the temple. Think of these layers as a cake, and we're helping these layers of the cake from being smushed into expanding, so great for increasing volume around the temples. Last time for the modified cat eyes, gently opening your jaw. Lips are forward, mouth corner is in, O is long and narrow. Place your fingers together before placing your palm ends on your temples, squeezing in and down against the opposite resistance from your hands, pushing in, up, and back. Relax your shoulders, relax your neck. This is going to lift your entire face all the way up from your mouth corners to your temples. Really feel the activation all the way from the sides of your eyes and upwards. Relax the area in between your eyebrows, relax your jaw, and release. Great job. Moving on to this area right below or on the cheekbone, we're going to do the same method, pinch and roll, wiggle and stretch, and start turning your fingers in all directions to get a nice flexibility and stretch through this area. We do have a ligament that connects here to the bone, and that helps with the contours of the cheeks and the midface. So we want to make sure all the attachments in this area are healthy and flexible. And then once this feels good, you're going to pinch and stretch, rolling upward from this area all the way up into your temple, helping to create more volume in your temples, bringing blood, circulation, nutrients to the skin, the muscle tissue, and helping to release any adhesions. Go ahead and switch to the other side. You should find an area where this feels like an attachment to bone. You just want to work around, going as deep as you can, pinching, wiggling, stretching, moving your fingers in all directions, helping to bring life into this area. Flexibility, hydration. You may need to reposition your hands to get a good hand placement. This ligament, this zygomatic ligament, is attaching right to the bone here and helping to manage the structure of our cheeks. So very important in maintaining the structure of our midface. When that feels good, roll all the way into your temple as far as you are allowed to go and release. Great job. Moving to the center of the face and the cheeks, we'll do advanced cheek lift. So inhale through your nose, drop your jaw, pressing your lips forward, making sure your jaw muscle is not activated. Wrap your lips around your teeth, and then place your palm ends on your chin to keep your O long and narrow. Make sure it's not forcing. Only activate from your lips pulling under and your cheeks lifting up. Send your mouth corners back to your back molars, back and up, and feel only your cheeks lifting. Make sure the lower face isn't hijacking any of this exercise, and then if you'd like, you can pulse your cheeks upward or remain still, lifting your cheeks up. Relax your forehead and the area in between your eyebrows, and relax your shoulders back and down. Keep breathing here in and out through your nose, checking in to make sure your jaw is not tensing, and release. Great job. Now we're going deep into these cheek muscles. So the first one is this yellow, the levator labii superioris, and here we're going to pinch this muscle. You can make the Elvis face, and that's how you know you have the muscle. It's the muscle that lifts the upper lip. So we're going to go in there as deep as we can, pinch and wiggle, pinch and stretch, and release any tension here. So this muscle actually connects to the eye muscle, and what happens is it can become very much like a knot in the center of the muscle, a very dense knot that feels like you can't break through it, and then the ends of the muscle will get very thin, so pulling down right underneath the eye, creating eye hollows. So we want to make sure this muscle is elongated and not filling up with tension in the middle of the muscle. So a lot of times you'll feel a big bulky center and then very thin on the outsides. So we want to work through that bulky center, distributing the volume through the muscle so it's not so tight and constricted in the middle and thin on the outsides. And then next we're going to move to the green muscle on the picture. This is the zygomaticus minor. And if you smile up to your eyes, you will know that you have it. It may feel like a tight guitar type string, but we want to pinch and wiggle, going as deep as we can to release any tension from this muscle, elongate and pull any of the restriction out of here. So as these constrict and shorten, this is when we're going to see the nasolabial folds and hollowness of the cheeks. And we're going deep here. For all three of these muscles, we're going in as deep as we can in this round, trying to palpate any tension spots and find out what is going on with these muscles in our own individual face. And then we're going to gently roll outwards one last time to the zygomaticus major. This muscle connects from the cheekbone to the mouth corner, and you may notice it's the most tense and the most restricted by the attachment point on the cheekbone. So go as deep as you can here. This is when you smile up towards your temples and your cheekbone area. This is the muscle that lifts the corner of the mouth and the cheeks going upward. So this can also be very tense and tight. We want to go as deep as we can, checking for trigger points, for areas that feel more dense or have different volume. And we want to smooth and elongate this muscle so that it's nice and healthy, relaxed, and then we can go and strengthen these muscles. We're going to switch to the other side. So moving all the way next to your nose, grabbing the levator labii superioris, pinching and wiggling, checking for any dense or any spots with a lot of volume. If it feels like there is a big center, actually we can massage through that. This is pulling all of its force into the center and becoming thin on the upper and lower parts, creating eye hollows. So the more we do this a couple times a week and keep consistent, we will palpate this dense center and help to elongate and take the restriction out of this muscle. So it's not pulling in and it's able to lengthen, and then we can lift and strengthen these muscles. But first we got to make sure that these trigger points are released. So you can pinch, wiggle, pinch and hold, and we're going to move over to the zygomaticus minor. So this is the muscle where you smile and you're smiling up to the eyes, going as deep as you can, coming into the muscle, noticing any trigger points, any dense areas or changes in volume. And we want to massage this muscle fully. And these are the exercises I would recommend for anyone who has been doing a lot of cheek exercises and not experiencing growth. What happens is the muscle tissue becomes constricted and it prevents the muscles from growing. So we got to make sure we do this step in order to have the most benefit from our workout and allow the muscles to grow. So starting at the inner part of the face, moving out towards the zygomaticus major. So this is going to be attaching from the cheekbone to the mouth corner, pinching and wiggling. And for all of these, we're going as deep as we can. So starting out as deep as we can, going in as deep to the muscle, finding any tension spots, pinching, wiggling, releasing, lingering in any spot that feels a little more tense or changes in volume, helping to release the adhesions from the muscle tissue. And then as we strengthen and then lift these muscles, they will have room to grow and expand and lift. So any spot that feels tight, you can hold, release any tension, and keep consistent with these methods as you go if this is something you're experiencing, these muscle knots. Great job. Release. And then moving back to advanced cheek lift. Inhale through your nose, drop your jaw, create a long and narrow O. Press your lips forward as much as you can without activating your jaw. Wrap your lips around your teeth and then lift your cheeks up like you're smiling, pulling your mouth corners in and back towards your back molars. You can hold here, lifting your cheeks up for about 30 seconds, or you can pulse upwards with your cheeks, Make sure your jaw is fully relaxed. Close your mouth a little if you need to. And relax your forehead, relax the area in between your eyebrows. Really focus on activating your cheeks and your lips only. Taking a big deep breath in through your nose. A long exhale, and you can release from the pose. We're going to go back to the cheeks. So starting at the muscle near your nose, pinching, really feeling into the muscle, looking for volume changes, trigger points, denseness, feeling a tender or even numb in any spot, and just pinching, stretching, massaging any of the tension of this area. And then we're going to move a little bit outwards towards the ear. So this is the zygomaticus minor. Pinching and stretching. This is the muscle that helps us smile up towards our eyes. And now that we've done both sides, you can notice how each side feels a little different. Keep going, breathing deep, releasing any tension, and then rolling over to the zygomaticus major, so attaching to the cheekbone and then all the way to the mouth corner. We want to get very deep here. You can smile, and then to know that you're feeling that you have it grabbed, you'll feel it activate. And really get in deep as much as you can, finding any trigger points, volume changes, tenderness. You can pinch and stretch or wiggle. You can hold. Each side might be a little different. How you access it and release any tension. Deep inhale, long exhale, and we're going to move over to the other side, starting on the inside, the levator labii superioris. Pinching, pulling, getting very deep. If it feels like you're not able to work through that muscle knot, you are. It just takes time and patience. Pulling, stretching, or pressing it deep. We're not pulling out. We're only pinching in and pulling up. So going at the same direction as the muscle. And then moving out to the zygomaticus minor. So being careful not to pull your skin outward. We're going in deep. Accessing deep into the muscles and the muscle tissue. Releasing any knots and tension, adhesions, the glue our body makes. And then once that feels good, we're going to come all the way down to the zygomaticus major, coming from the cheekbone. Really pay attention to that attachment point right at the cheekbone. It's most common where it will be tender and restricted. So it's going up from the mouth corner all the way up to the cheekbone. You can smile up towards your temples, your cheeks, to know you have grasp it. And then again, same thing, going in as deep as we can, pulling, stretching. Your fingers may be getting tired. This is our last round of this. Deep breathing and release. Great job. Last time for advanced cheek lift. Drop your jaw, create a long and narrow O. Rest your palm ends, the base of your wrists on your chin. Make sure your jaw is not activated. And if you'd like to try the dynamic form of the exercise, this time lifting your cheeks up, this is going to help strengthen and tone these cheek muscles, lifting our entire mid-face, supporting the under eye area, helping to reduce nasolabial folds, smile lines, hollow cheeks. Last few seconds, take a big deep breath in through your nose. Long exhale, go ahead and release. And we're going to go underneath the nose, pinch and roll. We want to make sure there's no attachments, adhesions in this area right underneath the nose where we have a lot of different muscle connections. So making sure this is flexible, soft. So just pinching and rolling outwards, going slowly here, feeling into the different layers, and then moving underneath the lips, in between the chin and the lips, and we're going to do the same thing. This is another attachment point of the mouth at the top and bottom, and so we want to make sure this area is nice and flexible, pinching, rolling, making a wave. You can close your eyes and really feel into what's happening in your own face. Remember to breathe, relaxing the rest of the muscles of your face, and just placing your awareness in this area below your lip. So it's the area right in the center. You may feel some attachment here. Take a deep breath in, a long breath out, go ahead and release, and we're going to move to advanced neck lift. So pull your lower lip over your bottom teeth and then bring your tongue all the way up to the roof of your mouth. Slightly protrude your chin and then take your thumbs, slide them underneath your jawline, giving your entire jawline a nice massage, and then rest your mandible into your palms. Now with your tongue pressing up to the roof of your mouth and your mouth corners pulling in and back so they're lifting up your cheeks and activating your cheeks, you're going to stretch with your neck up and then down. So stretching up and then pressing your mandible down into the resistance coming from your hands. So we should feel a deep stretch along the entire platysma muscle and release. Great job. And then on one side, come to the area right underneath your mouth corner, from the mouth corner to the jawline. We're going to stretch and pull vertically on this depressor anguli muscle. When this muscle becomes tight and constricted, it's going to be what pulls the corner of the mouth downwards and gives the droopy mouth corners. So we want to pinch and hold if you feel tension. Go as deep as you can here. So all the way as deep as you can go with either one set of fingers, or both, and then go ahead and switch sides. So pinch, get as deep as you can, and then once you're as deep as you can, slightly pulling in opposite directions vertically so you can get a really nice stretch in this muscle. So we stretch this muscle in some of our lower face exercises, lower and mid face exercises, but this is kind of going in at a different angle and adding some massage and tension release. And then from there, we're going to now work underneath the bottom lip, but now we're at the depressor anguli, so a little more on the side. So we just kind of went in and held. Now we're going to pinch and roll outwards, kind of waving your fingers to get as much surface area as you can, going from the deepest layer all the way maybe superficially. So covering this whole area. And as you twist your fingers, make sure to twist upwards rather than downwards. So if you add a little twist, rolling your fingers and then pressing your thumb upwards. We want to release any tension and constriction in this area. We don't want these muscles pulling downward on our lips, and then release. Great job. Advanced neck lift, second time. Wrap your bottom lip around your bottom teeth. Press your tongue all the way up to the roof of your mouth, even the back of your tongue. And then we're going to slightly protrude our chin, making sure the jaw is pressing forward evenly. Take your thumbs and massage underneath your jawline. This platysma in that specific area becomes very tight. And then pressing up and down with your mandible into the resistance from your hands. Mouth corners are moving back towards your back molar, so you'll feel an activation coming from a deep layer in your cheeks. Remember to breathe and make sure the upper face is completely relaxed. The area in between your eyebrows, relax your shoulders. Deep breaths in through your nose. Make sure your tongue is up at the roof of your mouth and release. Great job. So moving to the platysma muscle, coming to the area right underneath the chin, underneath the mandible, not at your throat, but underneath your jaw and your chin. And we're going to pinch and pull in opposite directions of the platysma muscle, gently and slowly rolling over to one side. This area can contain a lot of buildup of fluid, lymph fluid. And we'll move over to one side all the way to the jawline. And then once you've covered the area underneath your chin, we're going to move right underneath the mouth corners. And so one hand is below the jawline, one hand is above, and we're pulling the platysma muscle. So you can pull from the top and you should see the bottom kind of move. That's how you know you have it. We're just pulling in opposite directions, stretching this muscle out that gets very tight, especially in the area around the jawline. Bringing all the circulation, move all the way to the ear, and then starting from the middle and doing the exact same thing to the other side, pinching and rolling in the area underneath the chin, stretching all the way up towards the ear, and then starting underneath the mouth corner, one hand above, one hand below, pulling this platysma muscle. So this is like a mini facelift. This muscle, when injected with Botox, you can see the nasolabial lines start to disappear, because as this becomes tight, it's pulling downward on our other facial muscles. So it's like a mini facelift doing this platysma stretch, releasing any tension. And it's probably unconscious tension. You probably may not feel it, but it is affecting the way the face looks and feels. Great job. Last time, advanced neck lift, so wrapping your bottom lip around your bottom teeth, tongue all the way up at the roof of your mouth, especially in the back, feeling the activation and stretch along your platysma muscle. Chin is slightly forward, only as far as is comfortable for your jaw and is even on both sides. Pressing your mandible up and down like a swan, the shape of a swan neck, up and down into your hands for resistance, and then sending your mouth corners back and up. This is amazing for toning the jawline, stretching the platysma muscle, reducing jowls and marionette lines, helping to strengthen and stretch the skin on the neck, tighten the neck skin, also going to lift the cheeks and mouth corners. So much going on here. So starting again in the same way we did in the last time, right underneath the chin, in this area underneath your mandible, pulling and rolling out to one side. And then this time we'll stay on that side and do our platysma stretches. So you'll pull upwards, knowing you have it, seeing the bottom move, pulling your fingers in opposite directions, all the way along the jawline. So if it feels especially tender or tight here, I would suggest spending a little more time. And then we're going to move down towards the base of the neck and fascia roll up towards the ear. So pinching and rolling, just releasing some of the tightness in this area where we have a lot of lymph nodes, helping to relieve any pressure. And then we'll do the same thing on the other side. Starting in the center, pinch and roll outwards underneath the chin, underneath the mandible, the jaw, out towards your ear. And then back underneath your mouth corner, pinching above the jawline and below the jawline, pulling in opposite directions. Really want to bring some flexibility, some circulation to this area. Again, very important to notice what's going on, changes in volume, stickiness, tightness, maybe numbness in this area, needing some circulation, and then moving all the way as far as you can, and then starting down at the base of the neck, pinching and fascia rolling upwards towards your ear. You can pinch and roll, stretching outwards, checking for any areas of volume changes or stickiness, numbness, and then moving deeper into the massage in that area. Go ahead and release, and we're going to massage next to the ears. This can be a medium massage up and down, getting in both sides of your ears, the front and back, Close your eyes. Relax your face. Move a little quicker. Relax your neck and your shoulders. Connect with your breathing, taking a big deep breath in, a long deep breath out. Go ahead and release. Flow your fingertips down from your ears to your collarbone, helping to drain any lymphatic fluid. And that was your level 2 yin workout. Thank you so much for practicing with me. Namaste, and I'll see you in the next video.